So, Dr. Quinona, so let's talk a little bit about the use cases. What are some of those use cases which are moving to the home that have a need for real-time data and real-time interaction?
Yeah, right. I think Dr. Cordes actually touched on a few, but particular to CMS, they have the acute hospital care at home program, which is an expansion of the CMS Hospital Without Walls, launched in March 2020. So the immediate goals of that was to really allow experienced hospitals to quickly expand care to their Medicare beneficiaries, as well as the hospitals themselves are required to submit this monitored data on a per month basis. So that's one prong or one thing I see. Another thing is, but at the end of February, I believe, Humana's Medicare Advantage population will have in-network access to Mercy Virtual, which is the hospital without beds out in St. Louis. So it's staffed with greater than 300 clinicians providing proactive remote patient monitoring for patients at home in the hospital setting as well, that are being monitored again by Mercy Virtual. And this is really a value-based care play with Humana for their patients in, I believe it's Arkansas, Kansas, Missouri, and Oklahoma as well. And then lastly, I would say on one of the non-traditionals, so big tech, you have Amazon Care, but not alone, with Intermountain Health and Ascension Health that are founding members of the coalition, and they're really have been driving and lobbying to make permanent changes to the home care health reimbursement policies. So that's very huge. But they also have additional members, that's Moving Health Home initiative. They've got Landmark Health, Amwell, Signify Health, and several others. So there's a lot of forces that are driving these initiatives to moving health home.
I think today, if you look at just simple doctor-patient virtual visits or remote patient monitoring in the home for chronic diseases, as Dr. Cordes said, those require kind of discrete measurements, maybe a few times a day. As these acute services shift into the home over time, we think there's going to be a need for more streaming telemetry and continuous data. So that will cause some additional challenges and technical requirements to accommodate a different kind of data acquisition in the home.